the work you're doing, videoing me talking about this, asking questions and having me fill those questions, this is part of the process. If we can double this effort and everybody does their bit, even in terms of budget, NHS will have much, much less to spend on some of these illnesses. I really believe that.
Initiatives for arranging this to raise the awareness together with the engagement in the community can make a big difference. It will make a big difference in the health of Black, African and Caribbean men in the context of prostate cancer.
We found that if we raise this awareness, and as a Black person could be more attractive than to think and say, I need to act, I need to do something.
The advocacy is not being pronounced around the nook and crannies of the community. And if you want to see it in the community, most of the community houses now, they are being closed. The information is not being well circulated within that facility for other community members to generate impact in it.
My GP was just like, yeah, I'll be all right. You know, that's fine. Give me some medication. Didn't even actually mention at my age I should be testing for prostate cancer.
So I definitely think that there's not enough discussed about it, and not enough people would know what necessarily to do or the pathway to kind of get testing done or any information really associated to it.
Not all medical professionals know that Black men have an increased risk, so it's one thing for Black men and their families to be proactive, but it's also about healthcare professionals also being receptive to that, or even potentially raising the issue with their patients as well. So I really hope that this film serves those dual purposes.
If you have any disease, you have to hide it, because most of Black home, they don't want anybody to know whether they are living with any disease in their vicinity, because anybody who wants to marry from their domain, if they find out that many of their family are living with one disease or the other, they are not going to marry them from that area. That's one of the barrier that eliminates most African Black community to disengage themselves from where they can get or tap information which is going to help their lifestyle.
Yes, men are physically stronger than women on average. Genetically, we are structured differently, but I think we lean so far into that it means that for boys and men, it can sometimes be such a challenge to deviate from that narrative, to show a vulnerability, to show weakness, to say I'm not well. And I do believe that bleeds into why some men will kind of ignore symptoms, believing that they can go away, believing that if they moderate their diet, they exercise more, that they can manage it themselves, as opposed to actually thinking, well, there's something not right here. Perhaps I should go speak to my GP, or, get a second opinion if I'm not happy with the first.
What is a Black man and how a Black man should be, and so much stigma associated to it, and almost a level of glorifying at times, which can be very negatively impactful towards individuals and the culture and within the community and everything like that, of just keeping to a standard that you have to consistently stay at. And if you have a difficult day, you can't show that. If you have, a sickness or something, you can't show that.
Traditionally, I wouldn't want to look weak, to go to the hospital, say, I've come here for test for something I don't even suspect I have. Normally we would go for testing when you really now cannot sleep well, you can't go to work, or you can't function normally. And then we go for testing. And that's a primitive way of approaching health issues.
Testicular cancer, for example, is something that, check and see if there's any lumps. If you find anything, go speak to your GP. I think breast cancer is the same. With prostate cancer, there isn't necessarily that. It's, it can be asymptomatic and it can lay dormant for quite a while and not really cause any issues. So it's a very alien concept for a man to think, I feel perfectly fine, there's nothing wrong with me, I'm eating well, I'm exercising well, I'm healthy. Why would I go and waste a GP's time?
Black African men, they said, the head of the family got, you see that cultural thing, you've got to be the one to put food on the table. They're working 2 jobs, and day and night, and day and night. They don't have the time.
How men they behave, and they have that mentality that's masculine, to be there. But deep down there, they are dying in silence. Or they don't speak up much. And when you see a man come up and speak, it reaches the point now, I can't take anymore. Yeah. But we don't want them to reach that part. We want them, when it started, to catch it early.
Multitude of sins or people not doing their job can be covered by looking at black men's macho aspect to life and this and that. Personally, I wouldn't go down that route at this point in time unless there's evidence to back that up. I think what it is that it's the right person giving the right information to the right people. If someone knows that being macho means you're going to be dead of prostate cancer, they might change their mind.
Based on my own experience, there was a lack of awareness about what actually the prostate gland is, what it does, and then also, upon understanding what it does in terms of it producing semen, there is also, I guess, a stigma or taboo around it as well that also inhibited some people from being able to talk about it or feeling freely able to talk about it.
So prostate cancer, I'm quite happy to class that as a sexual problem through the African eyes. This is why a lot of my analogies are around sexual health, because I know the minute you say prostate cancer, I've got a dad who, I don't know whether he had it or he didn't have it, but he won't discuss it. This is in Africa, so it's just almost like this taboo. How can your father have problem there? You're not supposed to imagine, and when he goes there, he's happy for you to tell the rest, the members of the family, just headache, migraine and all that. That's not the problem. So you see, we're still miles away in terms of being able to discuss some of these things.
When the doctor used to have to put their finger in your anus to kind of test for things, some black people, and not only black, most men might find that a challenge if that's a thing. How do we educate, promote, support those individuals?
Part of the diagnostic pathway for prostate cancer is a DRE, digital rectal examination, which essentially is a finger up the rectum conducted by a GP to feel the prostate gland itself. And I would say that for most men, that was a little bit of a barrier, irrespective of their background, their ethnic background or their race. But for black men, it had an additional layer to it of a barrier in terms of the association of homosexuality, and that being something that for a lot of black men was perhaps too tall of an order to consider.
If I was to go to my typical group of friends and male friends and talk to them about what the process is like, I probably would not even finish explaining, because it's not something they're likely to comply with.
And then I think there's also issues around erectile dysfunction that can be a symptom, I believe, more likely if you're on treatment than a symptom itself of the condition. But again, I think it therefore means men who have experienced prostate cancer are probably less willing to talk openly about it because of the symptoms they're experiencing. So that ability to share knowledge with peers within their community sometimes, again, isn't there in the same way that you may see with other cancers.
That person don't move with him, it's not living with cancer. So they are going to be the number one stigma impact. They will stigmatize that person within the community, and the person will not have value for himself, because the way they normally come together and hug each other and say, don't hug me. So that alone can kill a soul. And if that soul is not somebody that have basic plan for his lifestyle, with that segregation, you can die with it. That's a lot of things in the community.
Thinking about prostate cancer as being something that is outside their control. It's quite difficult for them to comprehend when historically, from being a child and in the community, the culture that they belong to, it's this narrative of eating well, look after yourself, medication, and particularly in the African community, a lot of reliance on religion as well. So there was a lot of a sense of having strength either through your faith or your diet or your ability to look after your physical well-being, that they saw as all characteristics of being a strong individual. Raised as a black man myself, I would refer back to being a child. You eat your spinach, eat your green, you'll grow up to be a strong man, and that stays with you.
Because our major men, they always have the mindset of, unless I have an affair with a woman, that is when you have prostate cancer, or you have somebody that you don't trust and God uses it to punish you. That is our general belief about it. We're not knowing that any other thing that we are hitting or anything can generate from inside the body that can cause it. But people are just putting it as maybe as a cause from God. You say, I'm going through cancer. See, how do you come about it? When did it start? What do you do? Do you want to do something that is oracle doesn't allow you to do? Or are you being witch hunts? Or it's a lot of unexpected questions will just be coming out.
Hearing stories and speaking to my own father associated to just healthcare in general, and something that he very much would be like, that's not something that I feel comfortable going and speaking to a doctor about. Growing up within Jamaica, he very much was holistic beliefs in the sense of herbs will heal you a lot better than tablets, as well as, the community and spiritual faith and things like that.
In the UK, we've come a long way and we've become one of the most diverse communities in the world. Okay. However, that being said, we sometimes live on the past glories of being diverse and ignore the present. Also, remember recently we just heard someone say they're sick of seeing black and Asian people on the telly. All that feeds into this already. Those kind of off-the-cuff remarks that people just say, well, it wasn't meant. That plays a lot. Okay, so there are stuff like that black and people are dealing with on a day-to-day basis, and that might mean going to a white GP may be a barrier.
NHS puts it in there. Don't insult our clients. If you insult our clients, you are going to be our staff. We are going to call police. That alone is a barrier.
I got so frustrated. I started talking really loud at my GP surgery. I'm loud anyway. I mean, my wife says, you're loud. I hear you on the phone to your team, and it's lucky they know you. Everyone else will feel you're having an argument with someone. And straight away, the response from the reception, the response from them kind of took me back to, and this is my feeling. It was like, if you don't stop being aggressive, we are going to ask you to leave. And I'm like, actually, I wasn't being aggressive. I was loud, but I wasn't being aggressive. Now, I've heard people talk just like that, and they've not used those terms in the same GP practice. So there is these barriers that may be in place, and is that a barrier for some people gaining? I think it may well be.
We live within a society in the UK where structural inequality exists, and I think where we see evidence of inequalities within the healthcare system or evidence of health issues being more prevalent within certain groups, we do also see, unfortunately, that that's reflected perhaps sometimes in the structures that are there to support them. So in the NHS, we do know that there are issues of like institutional racism or unconscious bias.
Sometimes when I ask to see a female, say, why we've got a male, why? We see everybody here, why do you want to see female for religious reasons. Some people said I've been asked that, and then they've been put off. That kind of thing, you see. That's language. I don't understand you, and in the healthcare setting, supposed to be translators. Those things have come up, and they are there. They put people off to access healthcare, and the message has got to get out that is no good. It's not supposed to be happening at all. That's one of the barriers, really.
A thing that I remember hearing when I was younger, in the sense of that Black people have a higher tolerance. There's this massive stigma that Black people have a higher tolerance than white individuals, which is completely not true in any shape or form. But it does create this level of disbelief and also doubt within yourself, in the sense of, am I actually feeling as bad as I am? Am I making this a bigger thing than it needs to be?
I find it quite shocking. It's not prostate cancer specific, but there was data that I read that healthcare professionals truly believed that, Black people had a high pain threshold. This is 7 years after medical school. It's like, how have you gone through all of medical school and have this myth as a true belief, and how does that then play out in your practice? And we hear about those kind of instances when we talk about maternity care for Black women and the experience that they have, and their poor experience, and the complications of what they have, and the high risk of death. And when Black men hear that, albeit not them personally, it's their partner that's at risk, their child unborn is at risk, their sister, their niece. So it all adds up to this kind of fear of going into a system that we know has issues, has barriers.
With myself and my father being Jamaican, I think he didn't experience a lot of encouragement and support within the within the healthcare system. And I remember him speaking to myself and my brothers just about how you have to be mindful going into healthcare. You need to speak to people that are very similar with the way you look, just so they can understand you a little bit more.
I don't believe the government or anyone in healthcare purposely don't want to look at men's health. I think men need to fight for their own health.
People seeing other people getting out there to test and talk about it and openly, and destigmatizing yourself, so self-stigma can be, let alone the stigma from the community.
A really great way of approaching it is individuals with lived experiences. So if it was the case of emails, if it was the case of posters, if it was the case of newsletters coming through the door and just expressing, hey, I am also a Black man, I've gone through this experience and I understand all the stigma that's happening. I understand how you're viewing it this way, but I've lived this, and I promise you that there is like a safe space that you can come to and talk to and get, the help you need.
Faith leaders have a responsibility to really make that distinction between prayer and someone's faith, but also acknowledging that divine intervention can come through medical intervention. I think it's really imperative that as a community we look at different ways in which we can recondition how men think about their health.
Multiple skits, very short skits highlighting the dangers of not testing, what prostate cancer is, what we should be doing more to make sure that information is out there. Even delving into at what age do we think a man, young, at what age do you think they should be introduced to the subject of prostate cancer as an epidemic in England? Is it 12? Is it 13? Is it 14?
How are we going to overcome those barriers? It may be using more Black GPs, advertising them on telly to talk about prostate cancer. I think if I think of any adverts I've seen of prostate cancer, I can't remember how many of them were Black.
Maybe say a GP surgery, when you sit down and wait, there's a screen there, okay? And it can show, if so, a man is sitting there waiting to see his GP, whatever, and look at the screen and say, okay, prostate cancer, if you worry about it, even if you don't worry, please ask for appointment to do the test. I think it will be better.
In the community events, you see, social events. Now, like we got this month, we've got the Black History Month. So a number of events happening. I don't know what Shash is doing, but about the Black History Month, but maybe organizing anything. Just setting this fellow, this man, they go there.
That's where you get role models. Maybe somebody I've always admired. If you tell me that there's a platform like that one, and there will be, who do I really respect in Britain? My best British man, Gordon Ramsay. Oh, I don't see why I should not be there. You know, I would like to go and have Gordon Ramsay talk to us and say, guys, I'm not an expert in this, but the news that I've got about around prostate cancer, you should not be waiting. You should join me. I've already taken my test, and I feel that's how community develops the younger generations, and we hope that we'll be able to pass on this to the current generations.
For example, myself, I have 3 sons, you know. So this is something that I need to speak with my son. I need to talk about it. And not only my son, other, you know, colleagues, people who I work, my community, the people I support, to raise this awareness, because when you just talk about it, you start the conversation, you hear, oh, my brother, my uncle died with it, and what you have been doing, I didn't know what to do. But now I have a knowledge, I have to rise outside, and that is powerful.
I know definitely how important it is to talk about the reproductive, journey that I have to experience as a woman with my partner. So I think it was very much a joint discussion and encouragement of being like, if you have any health issues or concerns, and this is a safe space to talk about it.
They should ask those questions and have those discussions more openly. I know time is short, but actually taking 2 minutes of that 10-minute appointment to say, look, I just want to check if you're aware of this, if you understand, and would you consider having a test? That might be nice coming from a GP, because you're in that private environment, it's not so out there.
There's something around black men being able to feel that they can advocate for themselves, but there is an issue. There is an issue in the healthcare system where we know that, black men and the black community at large and other minority groups are often not heard in the same way that other communities are. And that's definitely something that I think as a society we need to try and address. And I think that starts all the way through medical practice and really just trying to dismantle this systemic racism within the healthcare system.
Because some of these patients have never been in the system before. They're coming from worlds where health is addressed in very different ways. Some of it is traditional, some of it is through prayer. Some of the problems they have around health are addressed using rituals that may not make sense in the Western world. So to accommodate patients with different needs, different backgrounds, different views on how treatment should be administered is important. It helps the NHS. It does not frustrate NHS.
You can just examine yourself every day. In what area have I stigmatized people today? You write it down. By tomorrow you can change. A lot of training, and they are doing a lot of training. Once the training is just 30 minutes, they just put their phone and they are telling, how are you? You all right? You want to see doctor? That is not a funny idea. But a changing part is, what have I done wrong today? The wrong of today can be minimized tomorrow.
Say, for example, if there's a poster that said just specific black men or African men, that for some individuals could feel almost a bit too intimidating for them to kind of see that. And I think it's the natural inclusion of just being like, you are like everyone else. You are a human being just like everyone else.
And that's the reason why this support is targeted to you. This other support, because of the results and evidence, is going to be targeted to that other group, not you. You see? The negativity will go away.
If I got an invite, it's a national screening, we're all invited. Now, there's a difference between me having to ask for it and you sending me an invite, okay? You send me an invite, sometimes feels, oh, well, someone's thinking about me. And if I choose not to go for that screening, there's another bit of work to do. But in the meantime, I think offering a national screening, especially, I think what I would like is that we target everybody in regards of colour.
So the reason for there not being a screening programme is because you could have a test and it could give you a false positive. It wouldn't, even if you had a false negative, and if you had a positive with prostate cancer, we used to call it a pussycat or a tiger. So a lot of men would die not of prostate cancer, but with prostate cancer. It's just a natural form of aging for a lot of men, and it doesn't really cause them any issues. For other men, they get prostate cancer and it can be quite aggressive. And you don't necessarily know that until you've got it, and sometimes you don't know immediately, and it's a case of having to monitor and watch to see how it progresses. So I think because of those complications, a screening programme hasn't been the easiest thing to think, how would that work? Could potentially have a lot of men coming in, potentially having a lot of false positives or what they would determine as pussycat diagnosis, going on treatment. That could potentially be more problematic than the cancer itself. So I think a nuanced approach has been up till now felt to be the best approach.
If because of my good health you want to reject me, so be it. Okay? But I'm sorry to say, you who is not having checked, you could be having an illness brewing up inside you. But I said openly, I'm going to have a prostate cancer check when I get the opportunity. Come, let's go.
Please, it's highly encouraging. Give everything to them to give you necessary support, because you don't know what is happening tomorrow. Because some people have the charisma of saying, I don't want anybody to touch any of my body. If they don't touch your body, if anything happens, they will still touch it.
Taking care of your health isn't just about you, it's actually about how you can show up for those that rely on you.
You know, you're bringing up the next generation. Women are obviously encouraging to talk to their sons about it, and then their sons will go off and, you know, build the world and talk about it with their friends and family. So it's just about creating a new cycle and creating a new way. Yeah, definitely very important.
I believe Prostate Cancer UK now have a risk assessment tool. So if you go into their website, prostatecanceruk.org.uk, you should be able to find it relatively easily, and just, you know, have a look at what that tells you. Order some information, it's free, and if you've got any concerns, go and speak to your GP.
Because the GP has got possibly 10 minutes, not more than that. So I have to list my question clearly, very specific. Just to the GP, so I don't miss anything. I prepare.
When you receive a text message, or your partner or your husband receive this, please encourage. Even go with him to the hospital, to GP, and do the test, because it's the benefit for both of you. Yeah.
Don't self-stigmatize yourself. Your health is your wealth. Your health is number one. You see, and then it will give you a peace of mind.
When you see an advertise or you see an information, even if you don't see any information or advertise, please go and ask your GP to do the test.
And you notice any small symptom, whether it's all the symptoms that mentioned, but it could be different. Like all this, you too much going for pee, maybe it could be diabetic, but it's also a symptom for prostate cancer, back pain, or all this strain, blood in your pee or something like that. So any lump or prostate, the glands or anything, you notice anything, those symptoms, quickly go for a checkup. You catch it early. Every health issue, illness or condition is about catching it early. Whatever you notice, it may not be prostate cancer, it may be just something developed which you can only be very sure and peace of mind when you've done a checkup and a test. That's services are there, the support are there. Whatever challenges for you to access this test or screening, the support is there, whether to break up the barriers that you may have. The support is there. That is my message.
I would say for me, it's your health, it's your life. Get yourself tested.
My black men, it is high time for you and I to do this test. Prostate cancer test is something that can help your future. It's something that can help all of us as a man. I've done the test and I'm free. What about you?